Alam niyo ba mga kasambahay na ayon sa datos ng World Health Organization noong 2020 ay umabot na sa mahigit 600,000 na mga kababaihan ng kaso po ng cervical cancer sa buong mundo at 342,000 naman ang mga namatay dahil sa sakit na ito. Kaya mga kasambahay, napakahalaga po ng pagkakaroon ng regular check-up dahil para malaman din natin ng maaga ano nga ba ang mga dapat natin gawin sa ating kalusugan. And for more awareness mga kasambahay, ano pa ba ang mga dapat nating malaman ukol sa health issues na maaaring makaapekto sa mga kababaihan? Para sa detalye, let's watch this.
Good morning mga kasambahay! I am Dr. Burley Balita, an obstetrician gynecologist from Asian Breast Center. And allow me to share with you today some information that will guide you to a healthy lifestyle, especially for women. Tara, join me and let's talk about it. To start, dahil Women's Health Month ngayong buwan ng Mayo, let's talk about first, bakit nga ba importante ang awareness tungkol sa iba't ibang health issue ng mga kababaihan? Two things. First, to facilitate preventive care. And second, to enable early detection and treatment of disease. Dito, we can address all reproductive and mental health needs and give health education and counseling. Okay? Primarily for prevention for women, dalawang importanteng test para sa mga kababaihan, pap smear and self-breast exam. That is very important to prevent future cancer in later life. Ano nga ba ang dapat gawin ng mga kababaihan para maiwasan ang mga komplikasyon ng kanilang kalusugan? So, ito na ngayon. Kung nagpapa-check up kahit walang nararamdaman, may iiwasan natin yung mga sakit na mas seryosong problema pag maagang nagpapa-check up. And reproductive health, nandyan na yung mga irregular menses, pelvic pain, contraception, family planning. So, maraming kailangang i-address ang kalusugan ng mga kababaihan. Kasi importante yon, ang ating mga kababaihan ngayon ay part na ng community. Marami nang nasa workforce, kaya importante na healthy sila. Nabanggit natin kanina ang pap smear. Ito ang rekomendasyon na taon-taon na pagpapacheck up ng mga babae tungkol sa prevention ng cervical cancer. No? Mapiprevent natin ng cervical cancer kung ang mga babae ay nagpapacheck, nagpapa-pap smear taon-taon. Kasi ang cervical cancer ay hindi hereditary disease, hindi siya namamana, kundi ito ay isang sexually transmitted infection ng human papilloma virus na pag ang nagkaroon sa katawan ng babae ay yung dangerous type na nagkukos ng cancer, in 15 to 20 years after exposure, pwedeng mag-cause ng cancer. So, mape-prevent natin yan pag nagpapa-pap smear. Pangalawa, yung self-breast exam. Napaka-importante nito sa mga kababaihan na nag-e-examine ng kanilang suso buwan-buwan dahil ma-achieve mo doon yung familiarization ng katawan. No? Pag buwan-buwan nyong ini-examine regularly ang inyong mga breast, mafa-familiarize nyo at anumang pagbabago doon anytime, kayo ang unang makakapansin na ikukonsulta nyo dapat kaagad sa mga doktor para hindi na-late yung diagnosis tsaka yung treatment. Diba? Pag alam na alam mo kung anong pakiramdam ng breast, kayo ang unang makakapagsabi nun sa doktor. So sabi nga ni Dr. Norman, breast cancer is also preventable nowadays. With modern technology, marami ng paraan para malaman kaagad, even bago nyo pa makapa, may mga technology na pwedeng makapag-detect ng early breast cancer at ito ay nagagamot at mape-prevent natin yung mga seryosong komplikasyon ng mga to. Kung mapapansin natin mga kasambahay, marami sa kababaihan ang ini-ignore ang regular check-up dahil wala naman daw silang nararamdamang sintomas. Pero ano ba ang dapat? Hindi na talaga kailangang antayin na may maramdaman. Kasi Pag may naramdaman na o may sintomas na, medyo late na ito. So, ang trust natin is prevention. And prevention is identifying early risk factors para maiwasan na magkaroon na ng sakit. Prevention is better than cure, no? Huwag nang magkasakit para healthy at mas masagana ang future. Ang kalusugan ng kababaihan, napaka-importante kasi sabi nga natin, ang babae ang siyang pagdala ng kinabukasan ng mga susunod na henerasyon. And as we end, I would like to take this opportunity to promote Asian Breast Center, our center located in Centuria Medical Makati, and is the most advanced breast center management in the country. Pag sa Asian Breast Center po kayo nagpa-check up, para na kayong nagpa-check up sa Amerika dahil si Dr. Norman San Agustin ay ating Filipino surgeon na matagal na nag-practice sa Amerika. At inuwi niya yung mga teknolohiya para maipamahagi at ma-share dito sa atin, mga kababayan. I hope this will help you guide to a healthy lifestyle, and as a female, sama-sama nating isulong ang mga tamang pamamaraan tungo sa tamang kalusugan. Again, I'm Dr. Burley Balita, obstetrician gynecologist from Asian Breast Center.
Thank you for sharing that, Dr. Burley Balita, an OBGYN from Asian Breast Center. And moving forward, mga kasambahay, very familiar na tayo sa salitang menstruation. Ako, lalo na po sa mga kababaihan. Ngayon, pag-uusapan naman natin ang tungkol sa menorrhagia. Ano nga po ba ito? Panoorin po natin ang paunang detalye.
Ang menstruation o period ay isang normal na proseso na buwan-buwan na nangyayari sa katawan ng kababaihan. Ngunit kung ito ay maging irregular o pagkawalan ng buwan ng dalaw ng halos isang linggo o mas higit pa, o di kaya'y makaranas ng sobrang menstrual flow, maaaring ito ay isang senyales na ng isang karamdaman. Katulad na lamang ng tinatawag na menorrhagia, na mula sa salitang Greek na min at regnumi, na ang ibig sabihin ay to burst forth, na ang implikasyon nito ay severe blood loss. Katunayan, ayon sa datos ng World Health Organization, mula sa edad na 30 hanggang 55, umabot na sa 18 milyong kababaihan ang nakararanas ng excessive menstrual bleeding.
At para sa karagdagang impormasyon tungkol sa menorrhagia, we have invited a medical professional in the field of obstetrics and gynecology. Let us welcome Dr. Romeo Mendoza, also known as Doc Romy, an OBGYN from Makati Medical Center. Good morning, Doc Romy, and welcome to Doctors on TV.
Thank you, Dr. Sarah, for inviting us.
Okay. Yeah. And baka simbatiin mo ng ating mga viewers.
Good morning po, everybody. Welcome.
Yeah, okay, and thank you, Doc. Pinaulakan niyo yung aming paanyaya. Marami tayong matutulungan sa ating pong tatalakayin ngayong araw. Nako. Ito, ayan, Doc Romy, no? Pwede niyo po bang mas idetalyado pa kung ano pag sinabi pong menorrhagia? Ano po ito?
Dati, nung few years back, ang menorrhagia, ang ibig sabihin nun, malakas ka mag-mens or mahaba. Ngayon, may bago ng definition ang menorrhagia. Ang tawag nila HMB, meaning heavy menstrual bleeding. Para ano na siya, encompassing so many symptoms of vaginal bleeding. Dati, meron tinatawag na menometrorrhagia o kaya hypermenorrhea. Mga technical terms ito. Na mahabang mens o kaya yung iba naman, polymenorrhea, meaning ang interval ng menstruation mo masyadong short. So, sa isang buwan, 2 beses. So, pinagsama-sama lahat sila and they call it heavy menstrual bleeding. So that is the definition. If you look at it, ang heavy menstrual bleeding is any kind of bleeding na nakaka-apekto sa babae, both physically, socially, mentally, materially, pag panay-panay. So, pag may ganun na simptomas babae, tinatawag na heavy menstrual bleeding or menorrhagia. Yun ang
I see.
terminology.
Okay, so but can this be very subjective? Kasi pwedeng sa akin malakas ito or marami, pero sa iba pwedeng hindi. So, I mean, can we quantify these menorrhagia before we come up with this kind of diagnosis?
Yeah, that's a good question kasi depende sa perception ng babae. Yan. That's why if you look at the statistics worldwide, it could range from 5% to 51%. Ibang culture, they're more sensitive to bleeding.
I see.
Tawag nila, ay, may problema na ako. So, to answer your question, dapat alam mo muna natin kung ano yung normal. So, ang normal is, ang duration is 4 to 8 days. Yun ang duration ng menstruation. The usual, ang tawag doon, 95% of women, ganun ang kanilang menstruation, between 4, yung duration, 4 to 8 days. Ano namang interval? Ang interval is between 24 to 38 days. Yun ang range. Tapos, yung dami naman, ang normal is from 5 ml to 80 ml. So, in effect, in the span ng menstruation, so pag 80 ml, that's equivalent to probably 3 tablespoons. Yun, parang gano'n.
Doc, excuse me, yung 5 to 80 ml, did you mean like yung buong like natapos na yun mula day 1 hanggang natapos?
Yes.
Okay. So kasi di ba ang 5 ml ay isang kutsarita?
Isang kutsarita.
So ibig sabihin kung kahit ganun ka-konti, it's still normal?
Still normal.
Oh, and 80 ml, so that would mean kung saan natin ilagay. Kasi ang isang kutsara kasi is 15 ml. So like roughly mga 5, ganyan. 75 di ba?
Okay.
Limang kutsara and
Okay,
mga isang...
right.
So basically,
You're right.
yun ang normal. Okay?
Yes,
So, and I do not know if you're familiar, sa isa bang regular na sanitary napkin, mga ilang ml ba yan?
May pictogram actually na ano yan, sa sanitary napkin. Pag minsan, pag konti lang, that's 5 ml. Ano? Pag ang definition, pag bubuo na yung dugo, then there's something wrong. Usually, hindi dapat nagbubuo, nagka-clot yung dugo.
I see.
Because that is a mechanism of the body. Pag masyado ng maraming menstruation, nagbubuo siya, the body preserves blood So, ganun ang mechanism. Pag buo-buo na yung lumalabas, of course, ibang usapan ko kung ganyan. Talagang heavy menstrual bleeding yan, no? Pero pag buo-buo na yung lumalabas, there's something more than the usual.
Yeah, kasi we would hear also stories from some women na hindi nagsusuffice ang isang sanitary napkin.
Yes.
Parang first that would be so uncomfortable for a lady, 'di ba? Na parang baka magstay na kaagad. So ang ginagamit nila would be a newborn what's this? A nappy diaper. Yeah. Yung ganyan. So so nakikita natin yung discomfort that menorrhagia can bring sa isang babae.
Then that is the definition. Pag it affects a woman, kaya nga yun ang...
kaya nyo hinima yung iba't ibang aspeto.
Kaya nga pag it affects the woman emotionally, physically,
mentally,
and materially.
Yes.
Pag ano.
Okay. So naku, napakaganda na explanation. Introduction pa lang to, Doc. Okay, ito. So basically, ano ba mga causes of menorrhagia?
Unang-una, or heavy menstrual bleeding, dalawang yan. It's either yung nasa uterus, yung corpus na tinatawag, yung bahay bata, yun ang pag menorrhagia, yun ang pinag-uusapan. Pag ang bleeding is coming from the cervix or the quelly of the cervix, hindi siya kasama doon. Those are for cervical cancer. So, we will focus on yung sa matres.
Sa matres.
Okay.
Yung pag sa menstruation
Sa
po.
menstruation.
Okay.
So, that is sa bahay bata. Yun na. Okay. Now, actually, meron kaming sa field namin, meron kaming a system of defining. It's called palm and coin.
Okay.
Coin. Yung barya. But the coin is with the E. So, palm is P-A-L-M. Okay. Palm. Ang cause doon, P is polyp. What is a polyp? A polyp is parang, it's an outgrowth sa loob ng matres. Ang loob ng matres ang tinatawag doon, endometrium. Pag may fleshy material na outgrowth yon, that's a polyp.
Yung parang conceal, Doc? Basta outgrowth.
Yeah, it's an outgrowth. It's a fleshy. Parang yan, no? Ano naman ang A? So, P-A. Adenomyosis, ang tawag namin. So ano naman ang adenomyosis? Adenomyosis, ano yan, parang it's also part of the endometrium, pumapasok sa muscle ng bahay bata. Ang bahay bata kasi parang gano'n sa loob, endometrium. Pag pumapasok yung endometrium or lining sa loob ng muscle ng mattress,
Na nasa gitna, di ba?
na nasa gitna, it causes inflammation or lumalaki. Adenomyosis yan. All of this causes bleeding. So, what's the next one?
L.
L. L is yung pinakasikat, leiomyoma o yung myoma or fibroid. Fibroid naman is a growth, a muscle growth na nasa mattress, whether it's nasa loob, nasa labas, nasa gitna. And usually, that's not cancerous in great majority. More than 98 to 99% of the time, it's not cancerous. And then, what's the next?
M.
M is malignancy. So, pag meron kang makapalang lining ng endometrium, siyempre, minsan investigate mo yan. It could be malignancy or a pre-malignancy. So, lahat nitong sa palm, parang if you look at it, ang tawag dyan, organic. May problema sa mattress structurally. Okay. Then the other side, coin.
Yung coin with the E.
With the E. So, C is coagulopathy. Coagulopathy is para may problema sa bleeding ng babae. When I say bleeding, an example of that is, in a month's time, parati siyang maraming bruises. So, kaya pag nag-nosebleed siya twice a month, parang gano'n. Those are signs, no? But that's not common. And it's usually hereditary or genetic.
Pero siguro, Doc, yung mga simpleng kapag ka nasugat, di ba, usually tayo madali namang mag-impis ang pagdudugo. Pero pagka may mga coagulopathy, sila yung mas matagal ang prolonged ang bleeding time.
Okay, nagpabunot ka ng ngipin para mas matagal as compared sa others. O kaya nga yung may history ka nung pag inopera ka, para madali kang duguin, mahirap control yung bleeding. So, those are signs, no? So that's the C. O is ovulation. Ovulatory meaning, ang babae kasi, the usual is, in the middle of the month, nag-ovulate siya. And that's the time she is fertile. Unfortunately, for some women, hindi sila nag-ovulate. And then, what happens is, nakakaroon ng sinatawag na the familiar term, meron ho akong hormonal imbalance. That is the ovulatory hormonal imbalance, which is the more common one, no? Na walang structural defect yung mattress. Coin E, there's a problem in the endometrium. Chemical, technical term, may problema sa bleeding mechanism sa thromboxane, prostacyclin. So difficult to know, but that is not common.
I see.
And then, N, not classified na yun. Yung di mo na alam kung what's the cause.
So anything else?
Yes.
Pero wala dun sa mga na-mention?
Yes, it could be a chronic infection ng mattress, kaya nagkakaroon ka bleed. So practically, yun ang mga causes ng
Okay, so there's really a wide range of causes pala, Doc, And ito bang menorrhagia, I mean, syempre, sasabihin natin, pag masyadong maraming dinugo, yun yung magiging seryoso na siya. But can this be life-threatening po?
Of course, yes. Yung bleeding kasi, pwedeng acute or chronic. Chronic meaning 6 months ka na dinutugo and then unti-unti bumababa yung hemoglobin mo, nanghihina ka. Yung acute, that's also life-threatening. Kasi ang tao, pag nawala ng about 2 to 3 liters of blood, may effect yan. Parang that is a very severe anemia already, yan yung natawag namin. And that's life-threatening. So, pwede kang mahilo, pwede kang could affect the heart, yung kidneys mo, because less blood supply. No? Parang kang nasaksak. Minsan, some bleeding is really very heavy na parang gripo na maano. Then you really have to control it. So, in those terms, it's life-threatening also. On the other hand, if it's chronic, yung pinagtsatsagan mo lang, wala kang iniinom na iron, and then, habang tumatagal ang panahon, pag kinuha mo yung hemoglobin mo, yung what we call CBC, it's so low that it causes parang so many things, yung panghihina, putlang-putla ka. In those terms, you might have a heart problem if it's a prolonged. Kasi, di ba, ang dugo naman na nagbibigay ng oxygen sa mga ibang party ng katawan natin. So, pag masyadong marami kang blood loss, whether it's acute or chronic, kumukonting oxygen pupunta sa organ. So, in effect, it's life-threatening, whether it's immediate cause of death or a parang organ problem eventually.
So it depends on the volume loss and the duration.
Yes.
Okay. And pero Doc, ito no, basically po ba ito hereditary din ba? Kasi parang minsan may mga naririnig tayo, ang lakas-lakas mag-men. Sabi, naku, hindi, ganun din ng nanay niya nung araw eh. So, I mean, or is it a myth or a fact?
Actually, yung hereditary, yung sinasabi coagulopathy, yun. Yung iba naman, kasi pag you're in the overweight side or obese, you're also prone to bleeding, yung ovulatory type. In those terms, probably yes. And also yung very maaga ka nagkaroon ng menarche, and then ganun ang lahi nyo. It could also be. Although not necessarily just because your parents or your titas nagkaroon ng menorrhagia, that's it. Although if you look at it, like say for myoma, a big portion of the female population may mga myoma, but then di naman necessarily may bleeding. Hindi naman necessarily gamutin yon. Hindi naman necessarily operahan mo. It's just so happen meron sila.
I see. And eto, Doc, gano'ng kabata yung pwede magkaroon ng menorrhagia? I mean, pagkatapos ba ng yung onset ng first menstruation, parang pwede anytime? Pwede siyang prone na rin yung isang bata para magkaroon ng menorrhagia? Or is it a case-to-case basis?
When you say menorrhagia, yun ang terminology or heavy menstrual bleeding. Reproductive age. So, kung titignan mo, yung WHO sinasabi, ang reproductive age is 18 to 48 to 49. So, that's the more common. Marami ding mga dalaga, yung bago pala mag-mens, na talagang irregular menstruation. And sometimes that's normal because of the ovulatory aspect. Meaning, hindi pa masyadong mature yung kanilang hormonal, yung tinatawag nila hypothalamic pituitary axis na nagbabalance ng menstruation yan. Kasi hindi pa siya mature dahil bata pa. So, nakaka-apekto yan sa menstruation. So, it's possible that it could happen at a younger age. But in general terms, from 18 to about 49 to 50, reproductive age. Pag nag-menopause ka, ang tawag doon post-menopausal bleeding na. In terms, pareho sila nagbe-bleed. Parang ganun lang ang separation. Iba-iba din ang management.
So, nasa criteria lang. Depende kung saan papasok. Okay, so, eto Doc, kanina kasi di ba we've been mentioning about yung dahil prolonged bleeding, okay, so very disadvantageous siya dun sa aspect na it can affect, okay, yung oxygen status ng katawan, di ba, na nakaka-affect yun sa mga blood supply sa iba-ibang organs mo. But apart from that, if we talk about like fertility or anything about the reproductive system of a female individual, so affected ba to? How can menorrhagia affect this?
Depende kung anong cause. Like say, a polyp can cause menorrhagia or heavy menstrual bleeding, tapos it causes probably a blockage. Or
structural defect.
Structural defect. So, adenomyosis pwede rin kasi adenomyosis is related to another term, endometriosis. So, that can cause, in terms of, myoma, depende sa location, it can cause infertility also. More so yung ovulation, may problema ka sa ovulation, hindi ka nag-ovulate, so the chances of getting pregnant is
very slim.
Very slim.
Oh, okay. Naku, Doc, hitik na hitik yung ating discussion. Dami namin natututunan sa inyo, ha? Pero ito, pansamantala muna natin ititigil po at papatuloy natin itong maya-maya po lamang. Naku, mga kasambahay, dyan lamang kayo at magbabalik pa rin ng Doctors on TV pagkatapos mo ng ilang paalala. Welcome back, mga kasangbahay! Before we continue our discussion, we'd like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv. And like and subscribe to our YouTube channel. Just have to type www.youtube.com/@UNTV News and Rescue. Naku, maaari niyo pong balik-balikan, mga kasambahay, ang mga episodes ng Doctors on TV sa aming pong Facebook page at YouTube channel. Kaya naku, after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Dahil naku, napakahalaga po ng pagkakaroon ng awareness tungkol sa kalusugan. At para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Romeo Mendoza, an OBGYN from Makati Medical Center. Doc Romy, ito, dadako naman po tayo this time sa mga diagnostic measures and treatment, okay? Pagka ang isang individual, female individual, ay merong menorrhagia, okay? So, Doc, ito, when do we say, ulitin natin, kailan nyo sasabihin na may menorrhagia ang isang pasyente?
Yun ang nga yung sinasabi ko pag nagde-deviate to sa usual duration, usual interval, o kaya yung amount, then you suspect. So, kamukha ng lahat, siyempre nag-umpisa yan sa history. Sa history mo, o ano po nangyari, bakit nasabing yung malakas sa menstruation nyo, ganito po, doktor, buo-buo, ganyan. Okay, those are things you consider. And then, number 2, of course, examine yung pasyente. Siya ba'y may bukol? So, you can do that by abdomen examination or a pelvic examination. And then, you formulate, so you have an idea. Siyempre, kung may bukol, more or less, alam mo na, no? And then you go to the diagnostics. Actually, ang unang-una, ipe-pregnancy test mo Kasi, it will be very unfortunate kung dami mong iniisip, buntis pala yung babaeng So, a pregnancy test is very crucial. It could be, nagdudugo siya dahil gusto siya makunan, or an ectopic pregnancy. Those things. Pag na-eliminate mo na yon, and then you go to the diagnostics. There's so many diagnostic tests. Others are blood, laboratory, imaging, may iba others. So, okay, let's go to, so kung example, na pregnancy test mo na, negative naman, so usually you request for a CBC, which is a complete blood count. Of course, we know that. It's a test yan na para makita na kung kumusta yung level ng hemoglobin mo, no? Of course, aside from other things na yung kung may infection, mga ganon. So, gusto mong ma-determine kung yung sinasabi ng pasyente, Dok, yung iba kasi, Dok, okay lang ako, parang konti na. And then you request for hemoglobin, napakababa. The usual is about 11 to 12. Makita mo, 8. So maybe there's a problem somewhere. Okay, yung iba naman, Dok, napakalakas talagang nakakatakot. And yet, it's 12. So, parang inaano mo kung the urgency of the matter.
Yeah.
Okay? So, okay, CBC, and then the pregnancy test. May mga ibang laboratory sinasabing for coagulopathies, but those are not common. Hindi masyadong, unless there are obvious signs na nagsabi, Dok, pag papabunot ito ang ngipin, tagal ba? Then, you go for those tests, no? Or example, meron na siyang thyroid problem, history, you get those tests. Or basically, as a screening, hindi sila, unless there's a part of
Need
your
for
history,
that.
you go for that. So after that, you go into imaging. Imaging naman tayo. So ano yung mga imaging? Imaging, the usual that we hear, it's a transvaginal ultrasound. Transvaginal ultrasound is an X-ray. It is a safe procedure, especially, di ba, pregnancy nga in ultrasound. So that ultrasound will tell us yung structure of the uterus. Malaki ba siya? May polyp ba? May adenomyosis ba? Those things, no? And then there's another one, yung tinatawag na SHISH, which is a saline infusion sonogram. It's a ultrasound also na may pinapasok na parang saline. It's parang water yun Tapos it tries to parang delineates the lining of the endometrium. So makikita mo doon kung may polyp yan. Makikita mo. No? Or even a myoma na nandun sa loob ng malapit sa cavity. Okay. Of course, the newer ones are hysteroscopy. Hysteroscopy naman is a visualization sa loob ng mattress. Parang small telescope, something like that. It's a tube. Then you try to visualize, and then you see kung may polyp o kaya kung myoma. So practically, those are the tests. And another test is, if for example, based from ultrasound, makapalang lining. Depende rin kasi sa actually, if you talk to sonographers, yung nag-ultrasound, the best way to do the ultrasound is on day, like say, 6 of your cycle. Kasi parang may definite measurement ng endometrium kasi depende sa time of your cycle.
This is for menorrhagia, yung day 6.
No. For example, talagang makapal talaga yung lining kasi it cannot wait anymore. I'm talking about a chronic at makapal. Then this comes now yung endometrial biopsy. The
Uh-huh.
endometrial biopsy, it will detect yung lining ng endometrium kung ito'y cancerous or precancerous. Nowadays, ano na yun hindi na yung parang dating renaraspa ka, parang ganun, under anesthesia. Ngayon, it's an outpatient procedure. May pinapasok na pipel and the patient is awake. You parang suction those tissues there. Then you send it to the laboratory. Mataas ang pick-up rate doon. Kung example, may suspicion ka ng cancer or of cancer.
Cancer.
Yes. So yun ang mga diagnostic practically yun ang
I see. Okay, but if we stick to menorrhagia, siyempre parang nakita natin, parang, di ba, we can see na talagang i-investigate kung ano yung, what's causing menorrhagia. But on the side, alam natin na profuse yung bleeding. So, I mean, do you have like a side management first para lang matigil? Okay, matigil muna yung pagdurugo.
Yes. Actually, medical management ang ano dyan. If it's an acute, heavy bleeding, which could be life-threatening, ang management is just to control the bleeding with marami. One of them actually is the pill, the common contraceptive pill. Yung dati, nagbibigay ng high dose of estrogen, whether it's IV or oral. Minsan nahihilo yung pasyente. But if you give the pill in a different kind of dosages, kasi usually pill, we are used to it na 1 tablet a day, yung mga ganun.
Yeah.
This one, you give it each day, 3 times a day, para to stop the bleeding right away. Aside from that, we give them tranexamic acid, high dose also, and then also yung NSAIDs, yung mga mefenamic, those things. That will stop the bleeding temporarily. And then from there, you can investigate already pag nag-stop na.
Okay, kasi syempre, Doc, at the end of the day, kailangan din natin ma-manage muna yung pinaka-immediate problem, lalo na kung nahihilo na yung pasyente.
Yeah.
And meron mga ibang manifestations na because of too much blood loss. Okay, naku, Doc, ang dami ko natutunan from you and talagang you really explained everything very well, no? And baka meron kayong ibang mga health advice that you can share with our viewers, okay? So, pertaining to our topic today.
Well, the pill is a very useful medicine, both for contraception and also for menstrual irregularities or bleeding. And then, I would suggest ko sa mga kababaihan, kasi they're prone to anemia. You should take your iron supplements, and then marami naman sa preparation sa market ng iron. And then try to eat food rich in iron kasi you're prone to anemia. So usually yung mga liver, yung mga laman loob, yung green leafy vegetables, those things. And besides, yung government natin, meron silang sangkap Pinoy na ngayon na in-encourage. Maraming fortified na foods ngayon, kahit cereals, they add iron there. So, yun, ang supplement. Sometimes, yung nutrition, yung food na kinakain natin, sometimes it's not enough. No? So, supplements, iron supplements.
I see. Thank you, Doc. And at this time, baka you might want to invite our viewers to visit you here at Makati Med. And baka may gusto kayong batiin.
Yung sa department namin sa Makati Med, OBGYN department, meron kami postgrad course.
Oh,
Dito
okay.
gagawin sa Makati Med on May 15. It's a very nice course. On, this time, Gynecologic Oncology. The title is Emerging Standard of Care in Gynecologic Oncology.
And this is open even to non-medically inclined. So kahit sino pwedeng mag-attend.
Yes, may
Okay.
may CPD units nga yun. So,
Para sa mga doktor.
no, even for nurses, medical health professionals.
Okay. So
they
for
can-
all medical groups.
Yeah,
no?
para pag nag-renew
Renew
sila
ng lisensya.
ng lisensya, meron silang CPD units.
Oh, thank you for that, no, Doc. Sige. Naku, yan mga kasambahay, mga interesado po, abangan niyo po ang kanilang postgrad course dito sa Makati Med. And baka pwede nilang i-visit din yung site ng Makati Med if you are advertising your invitation there also, Doc. Okay, thank you once again, Dr. Romeo Mendoza, an OBGYN from Makati Medical Center. Naku, we hope mga kasambahay, kayo po ay maraming natutunan sa ating talakayan. Consider this as your roadmap to adopting a healthy lifestyle. Place your health above busy schedules. Prioritize proactive self-care as your well-being is undeniably valuable. And with that, naku, may pag-uusapan pa po tayo mamaya sa pagbabalik po yan ng Doctors on TV. Nagbabalik po ang Doctors on TV. Ako, syempre, bukod po sa adults, dako naman tayo sa pangkalusugan ng mga bata. Ano-ano naman po ang mga dapat tandaan pagdating sa female children and teens genital area problems? Para sa detalye, panoorin natin ito.
Magandang umaga mga kasangbahay. I am Dr. Katrina Florcus Lacanay, your pediatrician for today. Ang vulvovaginitis ay isang kondisyon na nagdudulot ng pangangati at pamumula sa balat sa paligid ng ari ng isang babae. Ito ay madalas na nangyayari sa mga bata at teenagers na babae. Kaya naman narito ang mga kailangang malaman ng mga magulang tungkol sa vulvovaginitis, kung noong mga paraan upang maiwasan ito at kung paano matulungan ang inyong anak na gumaling kung sakaling magkaroon sila ng ganitong kondisyon. So let's start our discussion now. Ang vulvovaginitis ay ang irritation at pamamaga ng balat sa loob at paligid ng vulva at vagina sa female genital area. Ito ay nagdudulot ng pamumula, pananakit, vaginal discharge at pangangati. Ang vulvovaginitis ay pwedeng maranasan ng kababaihan anuman ang edad. Ito ay nangyayari sa kadahilanang ang balat sa paligid ng vulva at vagina ay manipis at madaling mairita, lalo na sa maliliit na bata. Kapag mainit ang panahon, pwedeng may extra moisture sa balat at ito ay pwedeng mag-cause ng vulvovaginitis. Ilan pa sa mga cause ng vulvovaginitis ay ang pagsuot ng masikip na underwear at damit, paggamit ng sabon na may matapang na ingredients, madalas na pag-bubble bath at paggamit ng sabon na may pabango, at ang hindi maayos na personal hygiene. Ang mga common symptoms ng vulvovaginitis ay ang sumusunod: pangangati sa genital area, vaginal discharge, redness, at irritation sa balat sa paligid ng genital area. Paano nga ba natin maiiwasan ang vulvovaginitis? Magsuot ng damit na malamig sa balat at hindi mainit sa katawan. Panatiling malinis ang sarili, iwasan din ang mga sabon, wipes at produkto na may matapang na pabango. Kung gagamit ng tuwalya para patuyuin ang balat, pat the skin dry and do not rub. Pwede rin maglagay ng petroleum jelly sa balat na may pamumula at irritation. Tandaan po na kumonsulta sa inyong pediatrician kung ang inyong anak or teenager ay may symptoms ng vulvovaginitis. And that's it mga kasangbahay. I hope marami kayong natutunan sa araw na ito. As always, consult your pediatrician for your child's health. Thank you again for watching today's episode. I'm Dr. Katrina Florcus Lacanay. Please follow me on my Facebook page, Dr. Katrina Flor Cruz. Subscribe to my YouTube channel, Dr. Katrina Flor Cruz. And please follow me on Instagram and TikTok, katrinamd.ph. See you everyone in our next episode.
At syempre mga kasangbahay, para madagdagan pa ang ating kaalaman, pag-usapan natin ang uterine prolapse na madalas na nararanasan ng kababaihan sa edad na 50 pataas. Pero paano kung ikaw ay 18 years old pa lamang at naku meron ka na nito? Ano nga bang dapat mong gawin? Para sa impormasyon, panoorin po natin ito.
Hello, I'm Dr. Prima Napalim, OB-GYN consultant, and welcome to Women's Health. Ngayong araw, pag-uusapan natin ang tungkol sa uterine prolapse. Marahil maraming mga kababaihan na hindi pamilyar dito. Ano nga ba ang uterine prolapse? Maaari bang lahat ng kababaihan ay makaranas nito? Yan ang ating pag-uusapan ngayong araw. What is uterine prolapse? Ano nga ba ito? By definition, prolapse, it is a prolapse of the uterus and cervix into the barrel of the vagina due to an endopelvic injury known as the cardinal and the uterosacral ligament dysfunction. Ito po ay isang kondisyon na buwa na kilala natin ng mga Pilipino. As the name implies po, na it's a prolapse, it means it descend or go down. At uterus is ang part of a female reproductive organ na ang matres. Kung i-combine po natin ito, prolapse, uterus. So, ibig sabihin po nito ay bumaba ang ating matres. Ano-ano nga po bang sintomas ng uterine prolapse? Ang most common is a bulging mass in the perineal area that falls out. It can be visualized or sensed by touch. So, nangangahulugan po nito Maaari po nating itong makita or mahawakan itong lumalabas na bahagi ng katawan ng mga kababaihan. Ang iba pa pong sintomas ay increased frequency sa pag-ihi or increased urinary frequency na tinatawag natin. At maaari din po magkaroon ng sensation of incomplete bladder emptying. Ito po yung nangangahulugan na umiihi po tayo, ngunit parang hindi tapos ang pag-ihi. Bakit nga po ba natin nararanasan ng uterine prolapse? Cause ng uterine prolapse or etiology. Papasok din po dito yung parang pathophysiology or bakit ito nangyayari? Ang pinakadahilan lang po ay ang weakening of the connective tissue ng mga kababaihan, na kung saan ang humahawak po sa matres ng mga connective tissue, ito nga po yung cardinal and uterosacral ligament, kung sa Pilipino ito tinatawag nating litid, na ito ay nanghihina na para suportahan ng matres, kaya bumababa. In other words, ito rin po itisabi nating pelvic floor dysfunction. Maaari pong maka-experience ang 18 years old na kababaihan ng uterine prolapse, ngunit sa mababang porsyento lamang. At may iba't ibang kadahilanan o risk factors na kakabit ito. Tulad ng nabinanggit ko kanina na ito ay dulot ng weakening ng connective tissues at kadalasan ang mga kababaihan na bata ay meron ng disorder na existing kaya nagkakaroon ng ganitong kondisyon. Ngunit, ang kondisyon nito ay mas karaniwan o common in an older age group or advanced age. Ano-ano nga po ba ang mga risk factor who are prone to having this uterine prolapse? Isa po dyan ay pagkakaroon ng maraming anak, lalo na't kung nanganganak ng normal delivery. Isa po dyan ay ang age, especially if we are belonging in the postmenopausal group or ang edad natin ay pamenopause na, kung saan mas lalo nang mahina ang ating mga connective tissues. Ang isa pa sa risk factor ay ang bowel dysfunction na nagdudulot ng chronic constipation or defecatory straining. Ang ibig sabihin po nito, yung hirap sa pagdumi. Kaya tuloy-tuloy ang pag-ire na napupuwersa ang mga ligaments or mga litid na humahawak sa matres. Ang iba pa sa mga risk factors ay ang lifestyle factors tulad ng obesity, smoking, or high-impact exercise. At meron din po tayong genetics factors tulad ng having an existing disease like connective tissue disorder, tinatawag nating Marfan's or Ehlers-Danlos syndrome, and also ang strong family history. Kung may isa po sa pamilya, lalo na sa first degree, na nagkaroon na ng ganitong sakit. Pag na-diagnose po natin na may uterine prolapse, yung treatment with this uterine prolapse depend on the stage and the symptoms na kung ano po yung meron. So, kung ang treatment po dito ay non-surgical, malamang ito po ang sitwasyon ay hindi po malala or nasa stage 1 or stage 0. And then, we have also surgical plan for advanced stage. Ang non-surgical method or ang first line is yung doing pelvic exercise na kung saan nagkakaroon tayo ng parang straining exercise na para lumakas yung muscle and ligament ng kababaihan sa gawing puwerta. Yun yung non-surgical method. Also included in this non-surgical method is putting a pessary. This is a silicone instrument that it is pushed inside the vagina. Those are the non-surgical treatment. Ang surgical treatment po is yung kung saan ooperahan na po, tatanggalin yung matres, pwede pong transvaginal or transabdominal. Ibig sabihin po nito, pwede pong ang pagtatanggal ng matres, since nakalabas na po siya, tatanggalin po mula dun sa ibaba, sa puwerta, or pwede pong sa tiyan, yung opera, no, sa taas. Pero depende po yan kung ano po yung sitwasyon or stage ng uterine prolapse na meron ang isang babae. Sana po ay marami kayong natutunan ngayong araw na to sa ating pinag-usapan. Kung meron po kayong katanungan at nais nyo pong magpakonsulta sa akin, maaari po kayong pumunta sa Dr. Josefa Belia Memorial Hospital, Tayuman, Manila at 5th floor. Muli ako po si Dr. Prima Napalim, isang obstetrician gynecologist, at palagi po nating tatandaan, lalo na sa ating mga kababaihan, that our health matters. Magandang araw po sa inyong lahat.
Napakahalaga talaga na nagkakaroon tayo ng awareness tungkol dito. Because early prevention is a key to avoid complications. And with that, we conclude our today's enlightening episode. At ang lagi naming dasal sa lahat po ng mga may pinagdadaanan, lalo na po sa kanilang mga kalusugan, may God bring healing and guidance to each one of you, mga kasambahay. Always remember, early detection saves lives. Make your health a priority. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
Sciatica kasi is actually a symptom, no? Hindi talaga siya sakit. So when you say sciatica, it actually refers to nerve pain, no? Ito yung pain na nanggagaling sa nerve sa likod kapag naiipit siya.
At yan po mga kasambahay ang aabangan natin sa susunod na linggo. And as we come to the end of this episode, we want to express our heartfelt appreciation to all our viewers for their unwavering support. Without you, we wouldn't be able to do what we love and provide you with valuable content. So, from the bottom of our hearts, thank you for your time and attention. We hope you continue to tune in and join us on this journey. And I would like to greet, syempre, unang-unang ating Kuya Daniel Razon na wala pong sawang sumusuporta sa mga adhikaing serbisyo publiko. At syempre, ang ating BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. Syempre, binabati ko yung aking kambal, si Iyo and si Iya. Hello. Si EJ, hello din. And kay Dr. Aline. And syempre, yung mga pasyente natin sa Barbacabodil Health and Wellness Center. And nanay and tatay, I love and miss you both. At sa ating pong makasambahay, maraming salamat po sa inyo sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sara Barbacabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, magandang umaga at maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barbacabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at ground floor Super 8 Warehouse Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Asian Breast Center is a premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Kalayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang, You may contact them at 0917-317-7272. Barba Cabudil Health and Wellness Center, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Barba Cabudil would like to express her gratitude to Medical Depot, healthy Num Num food. Where we do.